special event that we at DevX are co-hosting with our friends at the Private Sector Roundtable, which is part of the Global Health Security Agenda. This event is, to me, on one of the most important themes that often does not get discussed in the midst of a crisis like the one we're in right now with COVID-19. And that is, what do you do between pandemics? So I remember back in 2017, we at DevX published a report on global health security. We interviewed 40 leaders in this field, including people like Dr. Tony Fauci. And they all said the number one consensus point that came out from that report was that there was a high probability of a pandemic. And this pandemic would likely be some kind of a respiratory illness, some kind of influenza-like disease. And everybody, this broad consensus was that was the number one risk for global health security. The question is, what do we do when our scientific community, our medical community knows that these pandemics are possible, knows that while we're facing one right now, there's likely to be others in the future? What do we do to ensure there is an agenda to have a strong health system? And we really want to dig into that today, and especially the private sector role in that. And so I'm excited to bring to you a number of incredible speakers. We're going to be really engaging all of you. I know the people who are joining this event virtually from all over the world are remarkable in their own right. And so we're going to be engaging you in many ways. We've got poll questions we're coming to you with. We're going to have questions from the audience that we'll pose to our panelists. We even have an illustrator here, Josh Knowles. I'm really delighted to have him. He's going to be helping to capture a lot of our conversation in a great illustration. So I just want to say a big welcome to everybody around the world for what I think is going to be an exciting and engaging event. Let me just introduce our speakers, if I might. I think we've got a slide that will show you a little bit more about who they are. But first and foremost, I want to mention that we have the director of the Africa CDC here, John Kengasong, who, I think many of you have followed him and his work, and of course the work of the Africa CDC. This is not a quiet moment to be in John's chair. So to have him be able to dedicate some time for this conversation is really meaningful. We appreciate that very much. We also have the two co-chairs of the Private Sector Roundtable joining us today as our partners in this event. Ashling Mulvaney, who heads access to healthcare at AstraZeneca, and Alan Tennenberg, who's the Chief Medical Officer in Global Public Health at Johnson & Johnson. I mean, these are two companies that are very much at the forefront of what's happening today in the COVID-19 response, of course, very much in the news for their vaccine work. We're not going to be focused on vaccines, though, today. In fact, what we're talking about is the health systems themselves, and how do we strengthen those health systems when we're between a pandemic. But really, really delighted to have these two organizations and individuals here, and especially the Private Sector Roundtable, which we're going to be learning a bit more about in the course of this conversation. So with that, I want to begin, and I want to, of course, begin with John, Dr. John Kengasong, who I think everybody watching this, Dr. John, is thinking, we want to hear your take on how the pandemic response and how the pandemic itself is unfolding across the continent of Africa, a very diverse set of countries, but how do you see it developing now? Can you give us your overarching assessment of where we are today?
Thank you. Can you hear me? Okay, good. Thank you. And again, thanks for the opportunity of inviting me to be part of this very important discussion. I mean, we're all passionate. With Alan, I'm sure we started talking about health systems strengthening for long time ago. And I think we just didn't know that we'll be challenged on this scale. I think no one could have guessed that in 2020 we'll be in this amount of complexity. So the continent as a whole, maybe I should start with saying there are three messages that I like to start with for the continent. First is that the continent of Africa has not been spared by the COVID-19 as some would like to project in the media that the continent has been spared. That is one. The second thing is that pandemic was delayed and is gaining full speed now. And then that leads me to the third message, which is that we really need to be bold and aggressive in public health measures as if we have to have a chance of fighting the pandemic. So let me then just comment on where we are and then maybe segue to our unique challenges. I think as we speak, the continent has registered over 260,000 cases of COVID-19 and with about 7,000 deaths. And what is important is to note the increase. I mean, if you compare last week and this week, we are up about 28% with about of new cases, and then with about close to 60,000. That represents about 60,000 new cases. I mean, compared to last week, we are now seeing a daily new case rate of about 8,000, and that is significant. So the pandemic is gaining full speed and is very heterogeneous across the continent. If you take Southern Africa just as an example, South Africa would bear the greatest burden of the disease in Southern Africa as a whole. And I think South Africa probably is hitting very about 80,000 cases there. So the pandemic is gaining full speed, and our testing is not is picking up, but it has been also delayed. I mean, we are just now reaching 3 million tests conducted as a continent, which makes us not really comfortable in throwing out the numbers that I'm throwing out there, because many countries are still challenged. 80% of the testing on the continent is done by only 10 countries. So I think that remains a big challenge for us. So let me just end by saying that there are certain things that will work for our continent of Africa, and there are certain things that will not work for the continent because of this pandemic. Let me start with what might work in our favor. One is that, I mean, with the leadership of the continent was very aggressive in taking measures very early on. As early as February 22nd, the chairperson of the African Union Commission, Chairperson Moussa Faki, convened an emergency meeting of ministers of health. They all agreed on a joint continental strategy that was underpinned by the need to cooperate, collaborate, coordinate, and we've been coordinating a lot. Under the leadership of President Ramaphosa, who is the current chair of the African Union, he has been convening meetings regularly with about 15 heads of states. The last one was just last Thursday, where they got a detailed briefing from Africa CDC and discussed strategies as a continent. So that has worked very well for us. Second is that the courage in which the leadership across the continent took to lock down the economies, the airspaces very early on, where we still had just maybe few cases introduced, and in some countries, no cases at all. They declared state of emergency. And so that bought time and contributed in the delay in blunting the spread of this terrible virus. If some countries had not done that, the situation would have been in a completely different space and time by now. So I think all of that has worked out for us. Then the young population is also a factor that I believe is helping. I just got off the call with someone from Zimbabwe who was saying, look, John, we tested 5,000 people. We got 19 cases, and they were all young people moving around. And they say, are you sick? They said, no, we don't know what you're talking about. And then after 1 week, they follow them up. They say, are you sick? They said, no, we don't even know that we are infected. So that population size, because about the median age of our population is about 19 to 18 years, might be playing a critical role for us. However, what would not work for us is that as health systems are very weak, and this is a segue to this conversation, extremely weak. We need 6,000 epidemiologists. We currently have about 1,500 as a continent. Our delivery systems are very limited. Our workforce for healthcare workers, not even epidemiologists, are very limited. And 5,000 of those have already been infected across the continent. Access to hospitals, it would easily be overwhelmed. We are normally overwhelmed in normal times, and with the COVID-19, the chances that you overwhelm even more are very, very high. We're already seeing this in Egypt, and I think we'll continue to see that in many countries as we get the full blunt of this pandemic. So let me just end there at this point.
Thank you very much, Dr. Nkengasong. And you know, Ashling, I'm just thinking the last time we heard sobering comments like that about health systems was probably the Ebola crisis in 2014, when health systems started to get some attention. You know, John was talking about the national and international media, and how some are saying, well, Africa's largely been spared. Similarly, the message maybe in 2014 was, well, this is about health systems during a crisis. And then that message just falls away and we forget until there's another situation where hospitals are overwhelmed or we find we don't have testing capacity. What did change though after 2014, I think, was the universal health coverage agenda and Dr. Tedros' election and him pushing that issue. So I wonder, Ashling, can you give us your reflections on the UHC agenda and the global health security agenda, and where do these things connect, thinking about everything John has just described?
Sure, thanks, Raj. I can, and I think you raised some really valid points. And outside of all of this, we don't need a pandemic to see that health is a human right. Actually, what we do need to realize is that through universal healthcare coverage and that campaign and that agenda, how that supports the UN SDGs, but also looking at the global health security agenda, there is an opportunity to enable more to have access to healthcare, work towards building and expanding equitable and resilient, sustainable health systems. So the time for action is now. It's not to wait for the next pandemic. And as Dr. Kengason has said, it is about collaboration, it is about coordination. And I believe the universal language of the SDGs, I believe working on the UHC 2030 is driving that shared agenda. If we look then at the global health security agenda, look that it's 67 countries that have signed up for that. International organizations, NGOs, and private sector. And the view is to have there is that shared vision, to have a world of safe and secure global health threats. And again, to the comments made, we're only as strong as our weakest link or our most immature health system. And unless we work together and collaborate, we're not going to be able to achieve that and set ourselves up for success for when and if another pandemic comes.
I want to let everybody know who's listening to these comments that this idea of between pandemics is the main theme here. It's the hashtag. If you're following us on social media, use that hashtag between pandemics. And we're going to come to you soon with a poll. But Alan, I want to get your take on, let's say we buy into the vision Ashling has just described, that we can't just wait for the next pandemic, that we need to have a bigger effort to invest in the idea that health is a human right and strengthen every health system, even the weakest in the world. Where does the private sector fit into this? Where you work within Johnson & Johnson, a huge company, you work within the global public health component of that, where you're chief medical officer. How do you think about your own work, your own strategy as part of this big tapestry of organizations, public and private, trying to advance an agenda like universal health coverage?
So thanks, Raj. When people think about the way that the private sector gets involved in some of these initiatives, the first thing they often think about is corporate contributions, philanthropy. Those contributions, those programs are incredibly important. But what we're doing, the work that Ashling and I are doing in the private sector roundtable is quite different. The PSRT is really very unique. We really emphasize the capabilities of our members. What do our member companies do? What do we do best? And how can we bring those capabilities forward to support global health security and the global health security agenda? Let me give you an example. For example, you mentioned earlier on that both AstraZeneca and Johnson & Johnson are working on vaccines, and vaccines and therapeutics are incredibly important to the response to COVID-19. In the course of developing a vaccine for Ebola, which is still being developed and is still in clinical trials, we also developed in collaboration with partners the ability to use biometric iris scanning to track and monitor immunization with Ebola in the course of the program, the course of the development program. It's really a self-contained iris scanner. It runs on batteries. It's very portable. It can be brought out into the field, and it can help the people who are implementing immunization programs, whether they're related to the response to a pandemic or whether they're part of a routine national immunization program, to determine and to track how well that program is working. Now we're interested in scaling that up and making it open source and finding ways with partners to bring it to the people who can use it the most in the field. This isn't something that we focus on from a business perspective, but it's one of the positive innovations that came out of our work on a vaccine for Ebola. Well, we've just shared that through the PSRT with countries from the Global Health Security Agenda and with some representatives from the WHO. So the PSRT really thinks about the other things that companies can bring to the table, the other sorts of innovations and capabilities that can help to further and advance the Global Health Security Agenda and get us ready for the next emergency. Our members are experts in things like supply chain and logistics and transportation and advertising and communication. More generally, all of our members, and there's 17 PSRT members right now, have skills in business planning, in metrics and evaluation, and in training for our employees. We tend to be action-oriented. We focus on delivering results, all of those things that we need to run a successful business. And what we try to do is we try to bring all of these capabilities to the Global Health Security Agenda to help the GHSA achieve its stated goals. There are more examples. About a year ago, we entered into an agreement with the Ministry of Health in Uganda as an organization. The PSRT spent several months working with ministry officials and also with officials on the ground from the US Centers for Disease Control to identify the needs of the ministry and the capabilities of our members to see where they would overlap. And we were able to identify a suite of offerings and trainings in areas like antimicrobial resistance, metrics and evaluation and communication that we could then bring to the health ministry to help them do a better job of implementing their national action plan for health security. So the private sector is broad, the private sector is diverse, and through the PSRT, we're trying to bring what we do best to the fight against epidemics and pandemics in between the emergencies.
Yeah, you know this well, Alan. I mean, you're the founder of the PSRT, but others, I can say, I speak to lots of folks across different pharmaceutical and other kinds of medical health institutions. There's still a sense that, well, if you develop that perfect therapeutic, that perfect vaccine, that perfect drug, we're done. You know, our work is done. And actually, as I'm sure the CDC knows too well, most of the problem is not necessarily the innovation at that side. There's still lots of exciting, important innovation that has to happen. But so much of it is, how do you train the health workforce? How do you develop the supply chains? How do you make sure it's working and monitor and evaluate it? How do you hear from patients? And so much of it, as you just described, things like logistics, things like M&E, things like communications that you're supporting the government, the ministry in Uganda with. I wonder maybe Dr. Nkengasong, you could share your reflections on this before we go to our poll question on what are some of the gaps when you think of the private sector and the role they can play on strengthening health systems.
Yeah, I agree with Alan that the private sector, we shouldn't think of the private sector as a go-to resources for money. I mean, we should look at the private sector as truly an important stakeholder in this way. They can bring in innovation to address some of the gaps that you just enlisted: supply chain management issues and delivery, workforce development, and use of technology to resolving some of the information systems that are required to share information and data. I think you touched on something, which is you said the in between pandemics. I think there's I mean, the last one we had were not necessarily a pandemic, but an epidemic of Ebola in 2014, and now in between. Let me just make this statement, which I would do it in a very deliberate fashion, that we tend to hover between panic and forgetfulness very quickly. And I think a study must be done as to how we as human species can forget that quickly. When Ebola hit West Africa, we said, never again. And everybody was scrambling, never again. But then suddenly, I mean, and we wrote all very good reports. I mean, the nice reports published by the World Bank, the UN, published in the Lancet and New England Journal, which I read every day. And when I read those reports, I say to myself, well, maybe I should just replace Ebola by COVID-19 and I have the next after our pandemic report. I mean, we are ready to go. Nobody should waste anybody's money by commissioning a report of what happened with COVID-19. We have the reports there, but it's what I call the known do-nothing gaps. We know what the gaps are, but what has been holding us back? doing something with those known nothing. There's nothing we say here that we don't know about. I mean, the gaps in the health system strengthening. In 2008, 2010 timeframe, strengthening health system was really the topic of discussion. And then suddenly it faded away. And I think nobody talked about it anymore. And then Ebola hit, then it came back again, then it died. So I think there's that need for the private sector, for us to have a constructive discussion with the private sector and say, where can we use your technology, your innovation? Because I see the private sector as always the laboratory for innovation. And in a sense that it can push us to truly be serious. Let me just also make a statement that we've talked more about global health security than we've actually done anything with it. Okay, since it was created, I think there's been a lot of talk about global health security, but I can challenge that. I mean, it's just been more talk than action. And I think we need to be bold and take it seriously. And I think the COVID-19 is exposing us that we've actually been making a lot of proclamations and talk without any concrete actions in the field. Africa, I would end on this. Africa as a whole has 15 public health institutes. Okay, that is the likes of the Public Health England, Public Health Canada, the US CDC, or China CDC, 15 of that. If we are serious about that, going out of this, we should say, look, all 55 countries in Africa should have a functional public health institute. That way, we do not need to go to DRC and we shuffle from Mbandaka to North Kivu, then back to Mbandaka. That is what we should be able to have good surveillance systems that will pick this up, find a reservoir for Ebola there, because we are moving towards endemicity of Ebola in DRC, and begin to act on that. If we invested just collectively $100 million after the 9th outbreak of Ebola and strengthen a national public health institute in DRC, it will help us solve many problems, including Ebola, the measles outbreaks, the vaccine-derived polio outbreaks that are out there raging there. But we haven't done that. But each time we go in to respond, we spend more than $1 billion. Okay, we spent over $1 billion in North Kivu responding to that, but we are unable to find $100 million to support the countries to set up their national public health institute and networks.
And the economic losses, Dr. Nkengasong, are in the trillions, right? Because we've had countries have to shut down borders, shut down economies. As Ashling rightly said before, we're only as strong as the weakest health system. And so, sure, you can invest in your own health system, but if your neighbor doesn't have a strong one, if they don't have an institute, so we do need to be more ambitious at a moment like this. I think, Ashling, you wanted to jump in on it. What do you want to say?
I do. I think just to build on some of that, I think, if there is no access to healthcare, then that's a threat in itself, regardless of where we are in the continuum or the next wave of pandemic. So I think it's really important to remember that. And I think to build on everything we're saying, we have to make health systems everybody's business, no matter what part of multi-sector, NGO, government you come from. Because with engagement of citizens, community, civil society, and the private sector, we can make a sustained difference to healthcare. And that's really going to be important moving forward. I think also picking up on some of the discussion points, if we look, we know one size does not fit all. We've already heard from Dr. Nkengasong on that, in what will work, what won't work. But actually what will work in Zimbabwe may not work in DRC. And it's really important to work together to tailor those solutions and acknowledge, look at the whole ecosystem to see where can the difference make. And when we then look at the multi-skill set that we have in private sector, there's those nuances that can really support and make a sustainable impact to then have that preparedness, addressing global health security, but also looking at what is going to be the new business as usual in healthcare. Everything is changing.
Let's throw up our first poll questions. I want to hear from the people who are following us around the world, because we've started to get into this conversation about universal health coverage. What do you think is most important if we're going to guarantee it to people? And we've got 3 choices there. Go ahead and tell us your thoughts, and we'll look at the results. We'd love to get everybody's take who's following this on kind of what we're missing if we want to guarantee, what's most important if we want to guarantee universal health coverage. Dr. Nkengasong has gotten into this a little bit, that we just forget, right? We seem to have this collective amnesia after each pandemic. or each epidemic about these issues, and we don't seem to want to fund the institutions. Everybody has their own silo, they have their own issue, they have their own lane, and in the end, we're talking about building a system that everybody can work within. So let's see if we can have a look at the results of the poll and see what it tells us. Let's see, it looks like political will. The majority of people think that's really what's needed. I mean, to me, and I'm hearing this from a lot of people I speak with, that this is a moment, if we're ever going to have the political will, this is a moment to have it, right? Because the entire world, I mean, something none of us have seen in our lifetimes, the entire world dealing with the same issue at the same time, shut down in these dramatic ways. Boy, if that doesn't wake people up, I don't know what will. I don't know, Alan, if you have a take on what the opportunity is today to kind of mobilize everybody, including the private sector, to do more.
So I didn't know that the panelists wouldn't get a chance to vote, but if I that's not fair, Raj. But if I was going to vote, I also would have said political will, and I completely agree with you that there's a moment in time now that we simply cannot allow to escape us. When we look back, as Dr. John said, when we look back at the Ebola outbreak in West Africa in 2014 and 2015, sadly, I think we did let that moment escape us. The warning signs have been there. We've had SARS, we've had MERS, we've had outbreaks of H1N1 influenza. We've heard the alarms, we've heard the warning signs again and again, and somehow we let the moment escape us. Maybe it will be different now, and I certainly hope that it will be, because this is global. And it's hitting everyone at the same time. It's not only playing out in our daily lives, it's also playing out in social media in ways that it never has before. And it's playing out on the news and the airwaves and the internet and television like it's never played out before. And possibly this time, because of all of that, this will be a moment that we will not possibly be able to miss. And the global community will not allow our leaders to miss.
We're getting some great, sorry to interrupt, we're getting some great questions in, Alan. I want people to keep them coming. Maybe, Alan, I could just put a theme of some of them into you, which is, what is the PSRT actually doing now that's different because of this pandemic? Exactly as you said, it's a moment, it's an opportunity. What are you doing differently now? Where do you see the PSRT going based on the realities that we're facing today?
Sure, certainly. So the PSRT in the setting of COVID, we're also reassessing and reevaluating all that we're doing to make sure that we can actively get involved in the response and making sure that all of the capabilities and the capacities that our member companies can bring to the table are being brought to the table. We feel, as Dr. John said, that the private sector has a lot to offer when it comes to innovation. Innovative new techniques, innovative ways of getting things done. And in fact, what we've been looking at, and we've actually started doing, is asking our members to bring forward innovative methods, training programs and training capabilities. And I mentioned the vaccine monitoring platform that we've been developing in my company, and bring those forward to decision makers. And we think that's something that we can do now, immediately, and in the short term. There are other things that the PSRT members have been doing all along that I think have just become much, much more important today and now. Just as an example, there's an organization called the Supply Chain Network, the Pandemic Supply Chain Network, and that's an organization that was started by several PSRT members. It didn't emerge directly from the PSRT, but the PSRT is a very close partner with the Pandemic Supply Chain Network, by some of our members, the UPS, Becton Dickinson, BD, and Henry Schein. And the purpose of that supply network is to have supply chains that are ready, that are robust, so that we can understand how to get things from place to place, and that we can know where those critical supplies are around the world when we're hit with this type of an emergency. So the PSRT is stepping it up, certainly, in the setting of this emergency, but I really have to say the success and the impact of the PSRT goes beyond emergency response. What we've seen in the past, and I think Dr. John really laid this out very nicely, is that in the past, people do step up, but when the alarm bells stop ringing, unfortunately, some of the energy is lost and it dissipates. And we've seen that with private sector organizations in the past as well, that have been formed in the setting of response, like in the West Africa Ebola outbreak, in 2014 and 2015. What's different about the PSRT that allows us not only to be involved in the response, but also to stay there, to have staying power in between emergencies and out to the next inevitable emergency, is that we're embedded within the GHSA structure. We're on the GHSA steering group. We engage regularly with GHSA countries, with the WHO, the OIE, the World Bank, with civil society, in order to make sure that we continue to push the agenda in between epidemics and outbreaks. Like John said, there's too much talking and not a lot of action right now. I think the PSRT and most of our partners are about action. And I think that with all of the learnings that are still coming out from COVID-19, we'll only be pushing for even more intense action both now and in the future to make sure that we're better protected from infectious disease outbreaks going forward.
I know, thank you for that, Alan. I know Ashling wants to jump in. Go ahead, and I have a question I want to throw your way as well, Ashling. Go ahead.
Oh, brilliant. Thank you. And I just really to echo what Alan has said, but also to add, I think the pandemic is a situation where the PSRT can really demonstrate the non-traditional actors working together can make a difference. And the pandemic has given us the platform to amplify that, to continue with the engagement so our work still continues, but also lessons learned, as Alan has said, from Ebola, but from other situations in the health system, other areas around global health security, non-traditional actors coming together make an impact. And that's been demonstrated with some of the examples Alan has shared. So I'm ready for my question, Raj. I think we've lost Raj. I don't know if, Natalie, if you've got the question to hand.
Yeah, I do not, but I think it might be a good idea for the producers to pull up the second poll question, so we could have a look at that in the meantime.
So I think this is a great question, and it's a really good build on what we've had before. And we talked about political will as coming up top, but there was a balance between the other two responses. But if we look now at what is the current biggest threat to global health security, Alan and I and John, we can't poll on this one, but we will be intrigued to see the responses.
Great. Yeah, if we can maybe have the producer pull up the results of that poll, that'd be great.
So then if we look at this, I think, you know, similar to the previous, hey, I know you're joining back in, Raj, so I'll steal your thunder for a second. But if
Go for it.
If we look at where the response has landed, again, if we think back to political will, there's a look at weak health systems and limited pandemic preparedness. So there's a lot of interdependencies that we're seeing throughout the conversation and the discussion as to what we feel is going to be the biggest threat moving forward. And my belief, I think working together, engaging and galvanizing the strength of private sector to do partnership and collaboration can work towards addressing that. Raj, I'll hand back to you. Or not. He's digesting that. So Alan, I don't know, or Dr. John, if you've got any comments on what the output of that survey has showed. Shall we go to you first, John?
Yeah, so naturally, if you, I'm hearing an echo here. If you, the second poll, I wasn't sure what that long orange bar was. I mean, I couldn't read it. So if you just help me understand what.
Yeah, it was talking about weak health systems and lack of preparedness for the next pandemic.
Yeah, I think we have to, let me maybe go back to the first poll, which was about, talked about political will. And I would say that it's not enough to have political will. We should be talking of political will and political commitment. And because the will you get. I mean, if you call a summit of a special UN summit in New York and for people to, the head of states to issue a resolution on this. They will issue a resolution on the need for global health security there. But if there's no commitment to translate that, which we all go to these UN General Assemblies and we all issue these declarations, which is a sign of strong political will, but it doesn't translate to commitment in mobilizing resources and allocating resources appropriately. And this is not, and this starts from within. This starts from within my own continent to say, look, if this is really a priority for you, if this is an economic threat, a security threat, and a humanitarian threat, put your resources there. I mean, we have to start with that. I think that is important. Of course, if you put the resources, then you can really discuss in a meaningful way how to strengthen the health system. We talked of health systems at times in a very limited and restrained way, and which is a reflection of the pillars that were given to us by the framework that was given to us by WHO. But even infrastructure, we have to look at infrastructure, and it all requires resources, require money. And that money should come from specific allocations from national budgets before we look outside of the continent there. So I think it's the time for my continent to begin to look at ways that you decrease dependency by upping your game and say, look, these diseases devastate us, and we cannot count on externalities to address this. We can only count on that for cooperation. I mean, which, as we've seen for the first time in so many years, when we are faced with a threat that cuts across the whole world simultaneously, cooperation tends to be very limited. So I think you have to rely for your own health security, on your own, use your own means to support your own health security as much as possible. Let me just make one last comment that when we talk of global health security, we should always emphasize that it should truly be related to local health security. Because if we do not have local health security, that is, I'm in Ethiopia. If I don't start off by strengthening my own health systems, that will guarantee me my local health security, then it's meaningless to talk about global health security, where I mean, you have all this, the risk is very, very local. I think global health security should start locally.
Thanks so much, John. And unfortunately, I could hear everything you were saying even while I was gone. I had something brilliant to say, and the internet gods just shut me out right at that moment. Thanks for proceeding, and thanks everybody for taking the poll. We do want to get to more of your questions, and we had a great set of questions come in about making sure that this kind of effort, what you're describing at the PSRT, isn't just top down, that we're really engaging local communities, that we're using the power of technology to do that. And I wonder, Ashling or Alan, if you want to chime in on how you see the opportunity here to make sure this is not just a global level movement, but really it's responsive to the needs on the ground and sustainable. Go ahead, Ashling.
Yeah, thank you. And I think it's a brilliant question, but it really does reflect on what Dr. John has just said. There has to be local health security, but it needs to be supported by regional and global. We know one size does not fit all, and we know that everybody can't do it alone, and we have to work together on this. And, you know, when we think about health strengthening, capacity building, it's not just dealing with a vaccine and producing that. What happens post the vaccine? How do we ensure there's that sustainable healthcare? And it does go back that between pandemics, there's going to be a need for universal healthcare. There's going to be a need to have global health security. But only by working together, listening and having dialogue and really understanding the needs. But then also for, you know, when we look here from the PRST perspective, you know, what can private sector offer? How can we support looking at that multiple skill set to actually make a difference? And it may be that different partners, again, like I said previously, non-traditional partners and actors come together because the strengths combined make the longer sustainable impact. Alan, I don't know if you want to add to that.
Sure. Thank you, Ashling. To Raj's question, and also pulling in what John had mentioned previously about how local health security and strengthening systems locally are so critical. The PSRT, as it stands right now, is mostly made up of multinational corporations. We do very often take a sort of a global look at things or regional look at things, but at the same time, all of our member companies have local operations. We have manufacturing facilities, we have capabilities, we have employees. that live in some of the hardest hit parts of the world, both for COVID-19 and for other epidemics that have emerged in the recent past. So we have a commitment at the community level as companies and as an organization as well. One of the biggest motivations for companies to get involved in the PSRT relates to that fact that all business ultimately is local, and we have an obligation and a responsibility and an imperative to protect our businesses locally, which means protecting our employees locally in the communities that we live in. As a PSRT, one of our most effective engagements was with the health ministry in Uganda. We knew, and we've known from the start, that we have to be able to drill it down to the local level, to the country level, in order to be as effective as we'd like to be. And we have aspirations as well to recruit much more locally and to have a greater impact locally. I think this time world events got a little bit ahead of us, but that's absolutely an imperative that we have to circle back around to as we start to emerge, at least from the first wave of COVID-19.
One of the people joining us points out that in many of the countries we're talking about with the weakest health systems, actually there is a strong and vibrant local private health system, whether it's private clinics or pharmacies and others, and engaging that ecosystem is an important part of strengthening the overall health system as well. You know, one theme we haven't gotten to yet, and I'd love to get everybody's take on it. You know, Dr. John did mention in his comments that there have been 5,000 healthcare workers who have been infected with the virus, with COVID-19. And we at DAVX are doing a lot of coverage of the healthcare gap, this idea that there's a gap of 38 million some odd healthcare workers over the next decade. A lot of the countries we're talking about, that is maybe the number one issue, is just a lack of trained healthcare workers, a lack of a healthcare workforce. How does the PSRT see itself playing in that gap, in that need? What kinds of technology-driven opportunities might there be? Love to get everybody's take on this question. I don't know if Dr. John wants to start out.
So I think we have to, I mean, earlier on we touched on the silos of approaches. I think one thing we have to do in a very deliberate fashion is to say, well, if we are truly serious about this, we should coordinate our efforts more and stop working in silos. And this doesn't mean a control over who does where. I mean, if the partnership wants to, PSRT wants to work in Uganda, for example, as Alan and I were discussing some months ago, I mean, so good. You have a model that has worked out in Uganda well. I mean, then you have a vehicle at the Africa CDC to use that across the continent and in a standardized way, so that you begin to meet the aspiration of the continent. But what happens most of the time is that you have the Commission, the African Union, saying this is the direction we are heading to. But then you have other silos programs coming up, and then we just get lost and confused all the time. So I think that coordination of effort and agenda and targets is very important. If we say that as a global health community, our goal is to get 10,000 healthcare workers, say, in East Africa by the year 2025, then the private sector can really contribute in a way that we agree on the training models, and then they can deploy that as much as and where they want. In my previous life, I used to run a public-private partnership with Becton Dickinson and the Roche and Academy and whatever. That's exactly what we did. We conceived the programs, then worked in Mozambique, in Uganda, Tanzania, and Ethiopia in a standardized way. That was very good coordination. So I think my key message here is coordinated actions are very important. Targets are very important. We just don't run this initiative and this global initiative without targets. I think that is just clear. We cannot say for the past 8 years we want to roll out global health security agenda, and we just don't have the targets that we make up targets, and it's left to the individual countries to fill in those targets. And lastly, we just know that, I mean, tools that we thought we had a good tool emerging from the Ebola outbreak, the joint external evaluations, which gave greens to many countries in the West and others, just doesn't make sense. I mean, where are all those greens that were out there? So let's have a reset button and say, let's have an honest conversation. What do we really want to do? And to ensure that the world is safe, it has to do with workforce development in a comprehensive and coordinated ways, delivery systems, use of innovation and technology to drive some of these things, and then, of course, empowering the regions to take leadership on this.
If I could just come in on that.
Go ahead, Ashling.
Sorry, if I could come in, I think there's some absolutely brilliant comments, and I echo them. I think where I see the opportunity of collaboration is from a PSRT perspective, and in between our pandemics, we're looking at being proactive in our actions, and we continue to be proactive. What we're seeing with the current pandemic is that it's reactive, and there's a huge flurry of activities. Then there's a calm, and Dr. John mentioned forgetfulness, but then it goes into panic. But with the private sector, there's that longevity and sustainable approach. There's the long-term planning, but I think we can work together to take the learnings from different experiences, and Dr. John makes a point, if we set a shared goal, more people are going to work towards that. We see that, there's a lot of support galvanizing around UHC 2030. We see the great responses that we're having on the addressing of the SDGs. But I think when we look at global health security, it is about being proactive rather than reactive and looking in the long term.
Yeah, it's a great point. And I think as John describes, if we have targets, those can create some accountability. So it's a forcing mechanism, even when people might want to get forgetful, or they might want to be reacting to the next issue, to say, wait, we've all committed, these are targets, this is what we believe in. And yes, it's a long-term issue to strengthen a system, but if we don't do that, we won't get better at the next pandemic. Go ahead, Alan.
Yeah, if I could also jump in on that, this issue of frontline healthcare worker training and support and equipping frontline healthcare workers appropriately, it's the critical issue here. And I think that looking at the PSRT and where we've directed and committed ourselves, and also our member companies, we're member driven, and we're the collective of all of the capabilities and capacities of all of our members have demonstrated and continue to demonstrate a tremendous commitment towards funding, training, and equipping frontline healthcare workers. But obviously we need to do more. And I think that I can think of two areas where that would be incredibly helpful. One of them John laid out perfectly. We've had this, he and I have had this discussion before. The PSRT went first to Uganda, and that's mostly because the health minister invited us to work with her, and we were a brand new organization, and we needed to prove and demonstrate that we could impact on the ground, and that's what we did. But Dr. John has already mentioned that the way to do this is in a coordinated, widespread, continent-wide way. And the Africa CDC and the AU Commission clearly are partners that we can look at to try to move this forward in a more coordinated and comprehensive way, where we can share everything that we're learning and we can implement in a much more broader way. The second piece, I wanted to make sure to get this in during this talk, so I'm going to take the opportunity, is membership. We're member driven, like I said. We're a small organization, and I think we've done a lot with what we have at our disposal. But if we could double our membership, we could quadruple our impact or more. So to those of you who are joining this call who represent corporations, large and small, I urge you to follow up with us and talk to us about how you can get involved with the PSRT so that you can add to whatever impact you're already attempting to have on COVID-19, but you could stay involved between the emergencies, because that's where the real impact is to be had.
And Alan, just on that point, because we've had some questions about this, you keep bringing up technology and a lot of things that to me sounds like they may not be the purview of a healthcare company. They may be the purview of a tech company. So is the PSRT principally health organizations? Are there tech companies involved? How do you see this organization evolving?
Well, both co-chairs on the call today come from healthcare companies, but I'll tell you that of our 17 members, most are not healthcare companies. Companies that have an interest in global health security and a long history in contributing to the effort, like UPS. I mentioned communications. One of our members is McCann Health, a communications and advertising company. And ExxonMobil and Chevron are members of the organization. We have a technology company that works on data visualization called Click, and there are more members. I'm not going to mention everyone right now. But we all bring our unique skills to the table. We all bring our unique capabilities to the table. But the bottom line is we're all committed to the GHSA and to making sure that we are safer and stronger not just to the GHSA, but we've, I think, brought up again and again on this particular meeting that strong, resilient healthcare systems are at the core of health security. And our members collectively are engaged on that front as well.
So, Dr. John, we had a question that came in, and Alan just referred to the fact that it was the Minister of Health of Uganda who invited PSRT in. We had a question that came in about health ministers and really what they should be doing now. What's one key thing they could be doing? Because I can imagine you're probably on the phone with health ministers all day. And I can imagine they are right now feeling very focused on trying to mount a response to this pandemic, to this crisis. But at the same time, we're telling them, hey, you need to think about the broader UHC agenda and about long-term health security. So what's your advice to health ministers about how to balance the reactive with the proactive, in Ashling's words?
Yeah, thank you. The health ministers alone cannot do this. I mean, and we as the African Union and Africa CDC as a continental body that was set up by the head of states need to play a role and accompany the health ministers in this. This is more than a health crisis. There is a serious economic crisis, and it's a serious health crisis and a security crisis. So what we have done as a commission is to bring the two together, the health ministers and finance ministers together, and say, look, President Ramaphosa has set up special invoices. They are mobilizing resources from bilateral and multilateral. They have raised trillions of dollars in debt relief and debt standstill and other mechanisms. You finance ministers, we have to have a dialogue and say, look, you have to use 15% of these resources that are being raised to support strengthening health systems and fighting the COVID-19. Because what is killing our economy is the virus. I think we have to be very clear. Usually, I always use the kitchen sink approach. You say, well, if your kitchen sink is leaking, I mean, you don't focus on cleaning the floor, which is your economy, to make sure that you want to dry the floor very quickly. You focus on turning off the tap so that you can now have time to deliberately clean the floor and get back to normal. So the floor and the water on the floor that is damaging our homes is the economy, and the tap, the running tap, is the virus. So that cooperation between ministers of finances and ministers of health is needed, and needed now and urgently in a very transparent manner, so that health is not just an afterthought of distributing national budget, but is truly at the center of distributing the national budget.
Yeah, it's an important point. And, you know, we've been having this conversation about a virus, as you say, that is the main focus of the world, but we've had people asking questions about the reality is probably more people are going to die of other things than COVID-19. And especially in localized areas, you may have areas where HIV/AIDS is still a massive killer of people. I remember in the Ebola crisis, more people died of other diseases than of Ebola because of lack of access to the health system during that crisis. And so, you know, the person asking this question is trying to push us a little bit to say, how do we get mobilized around these other issues? How do we get the private sector mobilized around these other disease areas that might be more important in some ways? How do you think about this, Ashling or Alan?
So I think that's a great call out, you know, and that absolutely highlights why just this conversation together is important, because it is about, between pandemics, what is the healthcare systems looking at? And we do know that there's a lot of support around communicable diseases, like you mentioned HIV, but the comorbidities that go with that, if we look at non-communicable diseases, if we look at diabetes, if we look at respiratory infections, which is linked, obviously we know we see the connectivity with COVID, we need to address that now, which is why we need to have sustainable healthcare. We need to have that infrastructure set up. To Dr. John's point, we need to have capacity building and we need to have that training. So healthcare is integrated into the systems, and private sector can support, it can help, it's lean, it can be agile, but what's important is giving that power and giving that support to the local economies, giving that to the local healthcare systems. So when private sector is using its skill set elsewhere, there is that continuum of care, and it's looking at the whole ecosystem of the patient, and in particular looking at prevention outside of just addressing, as we've said, being proactive rather than reactive.
Yeah, prevention is a key element of the whole argument behind global health security. That relatively small investments, John talked about $100 million, relatively tiny numbers in the size of the response we've had to COVID-19 can make an enormous difference in reducing the human toll and the economic toll. Alan, did you have a thought on this? And we are getting toward the very end, but maybe a final thought from you, in fact,
Sure.
Alan, given the time.
So two of the disease areas that we focus on in our public health organization are HIV and multi-drug resistant tuberculosis. And we've been very concerned about people accessing care and getting diagnosed and treated in the setting of COVID-19. People are afraid to access the healthcare system, even in places where you can access the healthcare system. I think we've seen data on routine immunizations that are being skipped, which will only lead to future outbreaks. And just one last thing I'd like to point out is the mental health toll of all of this. And just considering the toll on people who are in isolation for long periods of time, the elderly and vulnerable who will be in isolation even for longer periods of time, and keeping out for each other and having an eye also on mental health in general as an important public health issue, but also on the augmented effect of lockdowns and of the pandemic on mental health in our communities.
Yeah, thanks for that. And as I said, it's been a dynamic discussion. I can barely believe we're just about out of time. So I want to go to Dr. Nkengasong for one final reflection from him. And then I'm going to come to you, Ashling, as well to help wrap us up. But Dr. Nkengasong, can you give us a final thought about this? You're in a dramatic moment in your tenure, in your career, leading the Africa CDC. Maybe give us a thought about where you want this to go in the future, when we look back on this pandemic and hopefully its eradication, where you want us to go in the future.
So I think it would need, as a strategic joint continental strategy has called for, it needs greater cooperation, it needs greater collaboration and collaboration. That's the only way we are going to solve this. Then for Africa, we need to really begin to ask ourselves the question if this is not the time for a new public health order for our continent, where the continent begins to manufacture its own diagnostics, actively take part in vaccine developments and drugs. And there's only three things that will bring us back to normal. Do we have a good drug? And do we have a good vaccine out there? And do we have good diagnostics? Those are three things that will bring us back to normal. And Africa cannot be a spectator in this. And because of this, we have a meeting next week on the 24th, 25th, next Wednesday and Thursday, where we will be actually discussing a comprehensive strategy and a framework for vaccine development and access for the continent for COVID-19. So again, thank you for this opportunity. Unfortunately, I have to skip over to my next call by President Ramaphosa. Thank you.
Thank you very much. I know everybody virtually is giving you a big round of applause, Dr. Nkengasong, for taking the time to be with us today. And thank you for your remarks. Ashley, maybe you can help close us out. Dr. Nkengasong talked about the importance of collaboration, including with the private sector. The PSRT is a platform that will allow for some of that collaboration to happen. So similar question as him, what is your call to action to people listening to this, and where do you want to see us go as we get out of this specific pandemic we're in today?
So outside of collaboration, coordination, for me, it's speed and agility. So really working together. Organizations work at different speed and pace, but if we don't act now, actually we're going to lose that momentum and that opportunity. And it's being proactive rather than reactive and looking at population health. It's a global challenge that we have on our hands. That's why we're looking at global health security. But by underpinning that with universal healthcare, we're going to achieve more together with non-state actors, non-traditional actors than we will alone.
Well, thank you for that message. Thank you for the work you're doing at PSRT, to the Africa CDC. I can tell you my own experience, this has been an intense moment, this COVID-19 crisis and response. I know people are working extremely hard. And so I really appreciate our panelists for taking the time to have this discussion with us, everyone who's joined the conversation, because it is easy to just focus on the moment and to not think about the broader systemic challenges like we are today. And I think this between pandemics idea is a really important one for us to consider and push out there. We're going to be publishing this recording of this video. Please share it with others who ought to see it. And we'll be putting out more information about the PSRT as well. So thank you to everybody for being a part of this. Thank you to our colleagues at PSRT. Stay safe, everybody.